Good day everyone, I'm Almaica Jane Arsino and now I will discuss about the vital signs including body temperature, pulse rate, respiration rate, and also a blood pressure. So, what is the pulse rate? The pulse rate is measurement of the heart rate or the number of times the heart beats per minute. As the heart pushes blood through the arteries expand and contract with the flow of the blood. So how to check your pulse? As the forces blood through the arteries, you will feel the beats by firmly pressing on the arteries, which are located close to the surface of the skin at certain points of the body. So the pulse can be found on the side of the neck, on the side of the elbow, or at the wrist. So here's the guide to check your pulse properly. First is using the first and second fingertips, press firmly but gently on the arteries until you feel a pulse. Second, begin counting the pulse when the clock's second hand is on the 12. Third, count your pulse rate for 60 seconds or for 15 and then multiply by 4 to calculate beats per minute. When counting, do not watch the clock continuously, but concentrate on the beats of the pulse. And the last is, if unsure about your result, ask another person to count for you. So if the doctor has ordered you to check your own pulse and you are having difficulties finding it, consult your doctor or nurse for additional instruction. So, what is the respiration rate? The respiration rate is the number of breaths a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths for 1 minute by counting how many times the chest rises. Respiration rates may increase with fever, illness, and other medical conditions. When checking respiration, it is important to also note whether a person has any difficulty breathing. Normal respiration rates for an adult person at range from 12 to 16 breaths for minutes. So, what is blood pressure? Blood pressure is the force of the blood pushing against the artery pulse during contraction and relaxation of the heart. Each time the heart beats, it pumps blood into the arteries, resulting in the highest blood pressure as the heart contracts. When the heart relaxes, the blood pressure falls. So, what is blood pressure? It's categorized as a normal elevated or just a stage 1 and stage 2 high blood pressure. So, normal blood pressure is a systolic of less than 120 and diastolic of less than 80. 120 over 80, the normal blood pressure. And elevated blood pressure is systolic of 120 to 129 and diastolic less than 80. So, stage 1 high blood pressure is systolic is 130 to 139 or diastolic between 80 to 89. And stage 2 high blood pressure is when systolic is 140 or higher or the diastolic is 90 or higher. So, why should I monitor my blood pressure at home? For people with hypertension, home monitoring allows your doctor to monitor how much your blood pressure changes during the day and from day to day. This may also help your doctor determine how effectively your blood pressure medication is working. What is special equipment is needed to measure blood pressure? Either an aneroid monitor, which has a dial gauge and is read by looking at a pointer, or a digital monitor, in which the blood pressure reading flashes on a small screen, can be used to measure blood pressure. About the aneroid monitor is less expensive than the digital monitor. The cuff is inflated by hand by squeezing a rubber bulb, and some units even have a special feature to make it easier to put the cat on with one hand. However, the unit can be easily damaged and become less accurate because the person using it must listen for heartbeats. With a stethoscope, it may not be appropriate for hearing impaired. About the digital monitor. The digital monitor is automatic, with the measurement appearing on a small screen because the recordings are easy to read. This is the most popular blood pressure measuring device. It is also easier to use than aneroid unit. And since there is no need to listen to heart rates through the stethoscope, this is a good device for hearing impaired patients. One disadvantage is that body movement or an irregular heartbeat can change the accuracy. These units are also expensive than the aneroid monitor. So about finger and wrist blood pressure monitor. Tests have shown by finger and or wrist blood pressure devices are not accurate in measuring blood pressure as other type of monitors. In addition, they are more expensive than other monitors.